All of the epinephrine auto-injectors and prefilled syringes in the hospital have expired or recalled. Kind of look like this. So the pharmacist must use epinephrine 1 to 1,000 for a patient having an anaphylactic reaction on the floor. This is what a 1 to 1,000 looks like. 30 milligrams per 30 milliliters. Concentration is 1 milligram per milliliter. And this is usually the epinephrine that usually comes pre-filled. It's 1 milligram per 10 milliliter. And this concentration is 0.1 milligram per milliliter. So this is 1 to 10,000, whereas this is 1 to 1,000. So the prescriber has ordered epinephrine 0.5 milligrams subcutaneous stat. How many milliliters of the available epinephrine product should be administered? So they want us to convert this 0.5 milligrams to milliliters. So I'm going to start off with 0.5 milligrams, and then I'm going to convert this to grams, because this ratio strength is in grams per milliliter. So to convert this to grams, for every 1 gram there's 1,000 milligrams. So I got milligrams here, cancel out milligrams here. So next I'm going to convert to milliliters using this ratio strength here, 1 to 1,000. So 1 to 1,000 means 1 grams for every 1,000 milliliters, or it could also mean 1,000 milliliters for every 1 gram. So these two mean the same thing. I know which one to use because I want grams here to cancel out with grams in the denominator here. So that's why I'm going to use this one here. 1,000 milliliters over 1 gram. Because I want grams here to cancel out grams here. That's how I know to use this one and not this one. So when I solve for that, 0.5 times 1 over 1,000 times by 1,000, that equals 0.5 milliliters. And that's your answer. So on the computer, numeric answer, no units or commas. Include a leading zero when the answer is less than 1, which is in this case. So you have to put a 0 here, 0.5. And that's your answer. So this, I like this question because it's a very realistic question, because these are 1 to 10,000 epinephrines. These go out of stock pretty often, like on shortage or recalled, one of those. So we always run out of these. So then I'd always have to use this, but it's 10 times more concentrated, 1 milligram per milliliter, whereas this one is 0.1 milligram per milliliter. So I'd have to draw out amount here. So in this case, in this question here, I'll draw out 0.5 milliliters here, because this is already in 10 milliliters. So I have to make it look like that. So I just draw out 0.5 milliliters of this more concentrated vial, and then I use like a normal saline flush. This is basically like nothing, just normal saline, right? It's just fluid. Well, this is 10 milliliters in particular. So I'd inject 0.5 milliliters of this and just put it in this, and then inject it straight into the patient, because you can't just inject 0.5 milliliters. Well, you could, but it's very hard because it's hard to push all that fluid into the patient. That's why it has to be in a bigger volume, like 10 milliliters total. So then once I get 0.5 milliliters and put it in here, it's the same thing as giving 0.5 milligrams of this. If this was 0.5 milligrams for like 5 milliliters. Yeah. And this is 1 to 1,000. So if you have any questions, please leave it in the comments.